If you can't walk as long as you'd like due to back or knee pain, a recumbent bike can be a great tool. Recumbent bikes are particularly good for seniors with back pain, sciatica, spinal stenosis, knee arthritis, and people recovering from knee replacements. In this video, I'll show you how to use a recumbent bike properly so that you can exercise more comfortably. Now, the obvious benefit of a recumbent bike versus walking is that you're not standing on your legs, and so it takes pressure off of the joints in your knees and your hips. Additionally, because your back is supported, you don't have to use your trunk muscles to support your spine like you would when walking or even riding an upright bike. Additionally, because an upright bike has a stroke that goes more up and down, you get greater activation of your hip flexors on the upstroke, and one of your hip flexors, known as the psoas, attaches to your spine and can create some compression. So because a recumbent bike has more of a back and forth motion, you get less activation of the psoas and less compression on the spine. Now, the backrest on this particular model has a nice curve that's ergonomically designed to fit the curve of your lumbar spine. And this particular model is the Merach S19 Pro. It also has a mesh backing so that your back doesn't get too sweaty when you're exercising. This one's particularly good for seniors because the handlebar folds up, so people with limited mobility can back right up into it. Even if you have a walker, you can back your walker right up to it. You can move the seat forward or backwards to get in or out just by sliding up and down like this. But then when you do lock it in, you want to find a distance away where you get pretty full knee extension, but you don't really have to reach for it. So your knee should extend fully but comfortably. I'm going to slide it up just a wee bit more there, and that's about right. Now, another advantage of a recumbent bike is for people recovering from knee surgeries or people who have lost some range of motion in their knee. It's a nice, gentle motion, particularly when you set it on the lowest resistance. You can just go around gradually for range of motion. And if you're really stiff, you can even start out just by going halfway and then going the other half and then going halfway and going the other half. And as a physical therapist, I can tell you almost exclusively when people recover from a knee replacement, I've almost never seen anyone not use a recumbent bike at some point in their rehab protocol. Let me know if you've had a knee surgery. Have you used a recumbent bike in your physical therapy? Comment below. So next we'll move to, once you can do those half revolutions, then you just gradually start going all the way around. And it is likely that you'll probably be able to go around backwards first. The first time you go around backwards, it may kind of snap around a little bit. So just be prepared for that. Go slowly. But once you're able to get it around backwards, it does become much easier. And then eventually you'll be able to get it back around forwards. Now, once you can pedal nice and smoothly, then you can start to increase the resistance. And it really kind of depends on what your goals are. If you're just looking to get a cardiovascular exercise, if you're looking to get some movement and blood flow to your knees, then you can just start to pick up your pace and get your heart rate to increase. And by the way, this does have a heart rate monitor. If you grip on to these metal handles here, it will start to pick up your pulse through your hands. You can also start to increase your speed, and that will help get your heart rate up as well. Or if you want to work your muscles to a little greater extent, there is a magnetic resistance where you can adjust the levels with just this gear shift here. So there's 8. This is the hardest level. And when it's at level 8, you can actually get a decent amount of resistance in here. When it's at level 1, it spins pretty easily. So regardless of your fitness level, you'll probably be able to get a pretty good workout with this. And as you can hear, it is a magnetic resistance, which is silent. And that's good for people who may have other people in the household. If someone's sleeping and you like to exercise early in the morning, it's not going to make a bunch of noise. The bike connects via Bluetooth to the Merach app so that you can take interactive classes, or it also connects to third-party apps like KinoMap and Zwift. When you're done exercising, if you need to store the bike, you just pick it up by this back handle here, and you can roll it easily for storage. Now, obviously, you can use a recumbent bike at physical therapy or at the gym, but the real value of having it at home is you can use it in short bursts. You can get on for 5 or 10 minutes at a time, whereas if you had to drive 15 minutes to the gym and 15 minutes home, you'd probably just skip it. So if you would like to check out this Merach S19 Pro recumbent bike, click the link down below this video. Thanks for watching, and I'll see you in the next one.